My name is Debbie, and I am Aiesha's mummy.
Her name is Aiesha with sake and lots and lots of them.
Yep. Your name was your name?
Aiesha the first sake.
Aiesha. Say Aiesha.
Aiesha with Aiesha the first sake.
Aiesha Elizabeth. Yeah. Moyamoya is a very rare brain disease. Now you have Moyamoya disease or Moyamoya syndrome, but basically it's the same thing. It's where your main blood vessel in the back of your neck here that goes up to feed the blood to your brain, it either collapses or it starts to shrink. So it's it stops the blood flow pumping to your head, which then can cause things like strokes, bleeds on the brain. So what causes that is your brain is a wonderful thing. It's absolutely wonderful. It tries to grow new blood vessels to take the blood to the main artery in the top of your head to help you function every day and things like that. So it grows like branches, but these branches are very weak, and that's what they can burst. They can burst when you sneeze, they can burst when you cry. So basically, that's what Moyamoya is. It's a puff of smoke. That's what it looks like, a puff of smoke. And it's named after the doctor who actually found it, who actually discovered it in Moyamoya. And as he was sitting there, apparently, with a cigarette and watching a puff of smoke, he says, "This is what Moyamoya looks like." So it's a Japanese word for puff of smoke. Oh, gosh, in a lot of ways. Um, it can look similar to dementia, where you forget things, things are just not working, you drop things, you lose sensations in your arm. Migraines is a big thing. They get lots of migraines. Visually as well, it can affect you where you can't see. As I said, stroke, seizures, personality just changes, and there's a lot of things you can't do. The heat in different weathers as well, it affects you. The heat, I've heard a lot of people with Moyamoya complain of bad headaches. They can't see, they've got to stay in. The cold affects them as well, so it could be anything like that. The blood pressure, your blood pressure drops, you faint, you just can't function. Yeah, it's not a very nice forgetfulness. I mean, Aiesha's forgotten she's eaten the tea before now, before she had the operations. This is why we thought it was Alzheimer's, because she'd eaten the tea. 10 minutes later, she turned around and says, "Where's my dinner? Where's my tea? You just had it." Of course, she'd get upset because she couldn't realise. So, I mean, this needed looking at. It was really scary. Yes, very much so. Very, very much so. Aiesha, as you know, she's an outgoing person and she likes to get involved. She tries to talk, but not a lot of people can understand her. So basically, it's quite difficult to say what exactly is wrong with her, what's going on. You have to watch, you have to study. Until you know Aiesha, you don't know what's going on. At the very beginning, when this all started happening, before we got the diagnosis, I thought she was just playing. She's just playing up. No, she wasn't, because I dismissed a lot of things. And when it started getting more and more, first of all, she started just crying. Nobody knew what she was crying about. She could be doing anything, and all of a sudden, she'd cry. She'd be here in Caritas with her friends and everything, having a good time. All of a sudden, she'd cry. Nobody knew. This had been going on for quite a while before I really thought, "Oh, something's wrong here." She'd had 2 TIAs. I didn't know. I didn't know until she had the MRI. Um, I, I know one day she came to me and she couldn't walk down one of the side. Her arm and her leg had gone. And I thought, nah, you're just playing me here. You just don't want to do this. You just don't want to do that. As a mother, and I thought, because she couldn't explain what was going on, it was hard for me to understand. You know, she couldn't say, I've lost. Where somebody say, I've lost it, she would just sort of like plonk herself down. Yeah, a couple of times that had happened before we got the diagnosis. Yeah, and then she started having abscesses, what we call abscesses, which I didn't know were seizures. I didn't know much about seizures. She started having abscesses as a baby. And when we took her to the specialist, she says, no, it's okay, she's not having seizures. Of course, I dismissed it because they said no. So obviously, this has been going on for years. She obviously had it as a baby, and it started to get worse as she got older. And it wasn't until I found out a diagnosis, I thought, yeah, this is what's been happening. Everything, the jigsaw puzzle had fallen into place. Everything was happening to her through the years. The visual stuff, they were doing operations on her eye. They couldn't understand why she couldn't see properly and things like this. They're doing all this. And, of course, you take them at their word. You don't know, you just take them at their word. But I've brought her up to be independent, a strong young lady, you know, and make her choices. It's her choice. If she doesn't want to do it, she doesn't have to do it. She packs her own things. She chooses her own meals. She cooks her own food. With me by her side, but she chose it. And I was proud of that. You know, she can go off with her friends. She can go to discos with her friends. Mum, I don't want you, which is fine by me, you know. And she'd do all that. But when it started getting bad, she didn't want to do that. She started withdrawing. Her personality changed. She'd be shouting at people. She'd be crying. You know, you couldn't understand what was going on. Hence, we're thinking early dementia. I'll tell you how it first started. Okay. Alistair, a disability nurse, he has been absolutely wonderful. I cannot praise him enough. He was assigned to Aiesha 18 months prior, before we got the diagnosis. And we came to the doctors with me, and they turned around and say, oh, it's just because she's got Down syndrome. Just, you know. And I took them at their word. And she says, oh, they're putting on this pill, they were putting on that pill, and this is not right. There's something that's not right. And I kept saying to him, there's something that's not right. Something's not hitting home. And anyway, he signed off Aiesha, which he's done his time, and the doctors have said this and that. And anyway, from my persistence, I kept going back to the doctor saying, look, there's something not right. So they got Alistair back on board. And then he came back and he says, right, Debbie, let's do this. So we did, and he came up with the idea, let's test her for dementia. So it was Alistair that got everything in place for me and to the memory team. And they tested for dementia. This is how we found out. Anyway, we were waiting for the results for an MRI. So we finally got the MRI in Preston here. And then we were still waiting waiting for the results. Alistair was on the phone to the memory team. They were trying to chase it up. Nah, we didn't get anywhere. So eventually the memory team had chased it up. They got it. They got the results. And Alistair got it all up and everything. And they said it was Moyamoya. And the memory team didn't know what was Moyamoya. You know, if anybody should know, it should be them. What's Moyamoya? Alistair didn't know what was Moyamoya. He had to break the news to me. And I was driving home. And Alistair said, oh, right, Deb's got the results. You okay? I went, yeah, I'm fine. Driving home. I just think if it's Alzheimer's, I'm prepared for it, because that's what you're told. When you have a child with Downs, you're told they can have early dementia. So you know about it, so you prepare for it, and it's great. Well, it's not great, but you know what I mean? Mentally, you're prepared for it. So he says, she's got something called Moyamoya. Moyamoya? What's Moyamoya? He says, Debbie, I don't know. So anyway, I said, oh, that's not too bad then. It's not life-threatening, is it? Me in my mouth. It's not life-threatening, is it? And he went quiet. And then I thought, what if I just opened up now, I've opened up a load of question here. So I was driving, so I pulled the car over and I said, right, Alistair, better tell me. And he turned around and says, it can be life-threatening. He didn't say it was, he said, it can be life-threatening. And the next thing he says, don't go and look it up because you'll get scared. So what do? Go home, look it up. Don't tell me not to do anything because I don't do it. And I look it up. And I could have fallen to the floor. What do? Where do I go? The first thing you see is, yes, it's life-threatening. There's no cure. And it explains, it's all in medical terms. Anyway, I found out about it through the tears and everything. My friends were great. They come up and they said, look, there's anything we can do. Not yet. I've got to process this, and it's processing it. But while I was trying to process it, she had a TIA. So, of course, I go straight to Preston Hospital. She was waiting there in that waiting room, at least 15 hours. They sent her to the stroke nurse. The stroke nurse was lovely. Remember when we went to Preston?
The Preston?
Yeah. You didn't like it, did you?
No.
You didn't like it. Sent her to the stroke nurse, and she turned around, she held her hand, she says, Debbie, I don't know what to do. We don't know about this Moyamoya. And when she went for the triage, and they said, look, she's got Moyamoya, she's just been diagnosed with Moyamoya. What's Moyamoya? And this was... And by this time, I was getting really frustrated because she'd been sitting in a waiting room for 15 hours and I was really frustrated. So anyway, I'm having to explain to them what Moyamoya is. I've only just learned myself what Moyamoya was. And in the end, I ended up saying, just look it up. Please, just look it up because I'm losing the patients here. And she wasn't well at all. So eventually, they battered the back and forth. Oh, you just have to go to stroke nurse. And the stroke nurse said, I can't do anything. Then she go back to the consultant. What can we do? So anyway, they admitted her. This was in the February, just after we got diagnosed. It was in the February. They admitted her. They still didn't know what to do. They were asking me questions. I was telling them about the stroke. Oh, that's not a stroke. Oh, that's not this and this is not that. We're in liaison with Manchester. So a week had gone past. I've got in contact with Manchester. Yes, but they haven't replied. What happened to Chester? She's had no treatment. Whatever you can do, I can do at home. She wants to go home. But in the meantime, they shifted her from one cubicle to a big ward where there was everything going on. And of course, she was scared. Not only that, she ended up getting a norovirus, where she was vomiting and... This was 24 hours just after they'd so of course she was in there even longer. So then she had a big seizure where she swallowed her tongue, where she was swallowing her tongue, her eyes were rolled back and she went. That's the first time I'd ever seen that, or a really big seizure. So they wouldn't let her out. They wouldn't let her go anywhere. I said, look, she's with me. Even if it's to take her up this ward to a cafe, I'll just get something different because she was going absolutely mad. And they'd never come and see her. Oh, what? We're talking about you, sweetheart. We're talking about you. Is that okay?
Okay.
Yeah? We're telling about the horrible doctors in hospital.
It was horrible now.
It was horrible, wasn't it?
Yeah.
Yeah, we don't want to go back, do we?
No.
No. Deal?
Deal.
Okay, we're not going back there, are we?
You're not nice with doctor.
No, what did they do to you?
It was his fault.
It was his fault, was it?
Yeah.
Yeah. So anyway, so she can understand what was going on. Yeah, and in the end, I said, look, you either do something or send me home and I'll get in touch with Manchester myself. So anyway, they says, right, we're going to send her home and we're going to you're going to have to give her aspirin. So I've been doing that anyway. I've told you this. I've been giving her a baby aspirin because that's what it said. When I looked it up, I've been giving her a baby aspirin a day. So basically, she's been here for 3 weeks and you've done nothing. You've not even come to really talk to me. I've had to chase you, you know. So anyway, they let us home. And they said, right, we're going to send an email to Manchester, to the consultant and everything. 3 weeks, nothing. Nothing. So I phoned the consultant's in Manchester's secretary. I phoned her. And I said, if you had a letter from Preston, they said, no, we haven't had it. So anyway, back and forth. The secretary in Manchester was lovely, back and forth. So in the end, I had to phone Preston to send a letter by email to Manchester to refer her. And as soon as that had gone, Amanda, her name is, Mr. Holsgrove's secretary, within a week or two, she had an appointment. Why couldn't they do that 8, 9 weeks, maybe 10 weeks beforehand? You know, so she's had that wasted time in hospital. And for the letter just to be emailed to Manchester, it was another 4, 5, 6 weeks. You know, by the time we got the appointments, like 3 months, 4 months had gone past. So this time I was pulling my hair out. That's the only bad experience we've had is in Preston. The rest in Manchester's been wonderful. It really, really has. So can't really, hasn't it?
Yep.
Yep. It's been great.
And it's just great work.
Yeah, great work, wasn't it?
Yep.
So yeah, the treatment here, and I'm not the only person that's experienced it. There's quite a few people that I know have experienced it, but I'm not here to talk about them. You know, it's just Aiesha. It's all about Aiesha. Who was it about?
Really?
Yeah. It was scary.
Yeah.
It was. I couldn't see the wood.
Yeah, exactly, yeah.
And I spent a lot of time crying, fighting. I've had to fight.
No.
Didn't I?
Yeah, no, didn't you?
Just for her to get the treatment. Even now, I'm still fighting because I take her to the doctors. I'll give you an instance. They've put her on Keppra, and she come up with an allergic reaction. From my doctor and says, "You've got the details there of what medication she's on. Can you, you'll have to go back to Salford." They wouldn't see her. I'm just thinking, all you have to do is send an email and talk to her. So I'm doing the doctor's job for between me and Salford. What's better than Aiesha? You know, so yeah. Alistair did a passport for Aiesha. Not one nurse looked at it. Not one doctor looked at it. We took it. This is what Aiesha likes and everything else like that. And
Exactly.
nobody looked at it.
Yep.
Did they?
Yep.
Yeah.
Exactly, yeah.
Exactly. Nobody looked at it. So it's those little things to take the time to try and listen or to find out before they come and talk to her, find out about this person. You know, that's non-verbal or you can't understand. You know, and it's not like going to see a typical developing patient. I've got this ache, I've got that ache, I've got that ache. You know, there's a passport there. It tells you where it hurts and everything. Just look at it. You know, not one person looked at it, and that was a bit disappointing. Why do we do this? They said passport. Why do they do it if they're not going to take any notice of it? So yeah, caring that and awareness in that, I should say. Not so much care, awareness of the person that they're treating. Information. That is that once you've got the information, you know and where to go, what to do with it. That is the most. And knowing that I can pick up the phone, I can phone Alistair or phone the school or phone. But if I'm worried about something, I'll pick up the phone. Alistair, this is happening. And he say, right, Debbie, right, you'll help me. put it in place.
Yep.
He'll know who I can contact, or he'll print out something easy reading or something that will help Aiesha. So it's a point of contact. Once you've got that point of contact that can lead you anywhere,
Yep.
it opens up a whole new world. It really, really does. And that is one of the most comforting things, you know. I mean, poor Alistair, he's had to pull up with some rubbish from me. He really has, you know. And he's great because he comes to the hospital visits, and it's good that you've got somebody else there with you, because you're listening, but you're not taking it all in, and you forget by the time you've gone out. So then I can bounce back. And did he say this? Or I forgot to say this. So he says, right, we'll go down this route. You can't get all the information in at the one visit, even though you want to. You think you can, even if you write it all down. I either lose what I've written down, but having that person that's by your side, that you can sound off at, you can they can point you in the right direction, and that's like having a cushion. Does that make sense? A cushion, support. That's the word I'm looking for. Support from just one person that knows what you're going through, that can put you in touch with health professionals. You know, there's places. As you know, I'm campaigning now for Moyamoya, and especially for people non-verbal. I phoned Alistair and said, look, I want to do this. Where can I go? And they said, hang fire. And even if he doesn't know at the time, he'll find out and put me in the right direction. I'm not going to do it myself. It's not a problem. But as I said, there's not a lot of people like me. Yeah. The support, that's what's needed, the support, awareness, and knowing where you can go, you know, to open doors. I've opened a lot of doors since I found out about this. I've spoken to people that I never thought I'd ever dream, big consultants, and, you know, I've told them what I've wanted, and trusts and people like that, and yeah, I've grown. You know, I've grown, and if it wasn't for Alistair and Caritas, you know, because I know that she's safe all day, so I can get on with what I've got to do.
Exactly, yeah.
Yeah, and she's having a ball, so I'm not focusing on how she's doing. You know, if she's upstairs, if she's having the sofa. You know, I know if there's anything wrong, they'll phone me, so I can push that aside and then carry on with what I've got to do, like campaigning and things like that. I've started a website for Moyamoya, and for anybody to reach out and talk, tell me your feelings, because the people that, it's not just the website, the groups, the people know what you're going through. I believe that you can help anybody fully unless you've been through that situation yourself. Once you've been through that situation yourself, you can walk beside them and advise them and say, well, this happened to me, but, you know, reach out to this person or reach out to that person, or I can get in touch with this person for you, you know, and yeah, it's communicate.
Yeah.
Communicate. I mean, it's a bit of a shame there's not that much in the UK. Lots of stuff. I'm doing the American as well. You know, lots of things are coming through in the information, but it's different in the UK. The way that they're doing things is different in the UK. So basically, don't be afraid to open your mouth. Don't be afraid to say something wrong. If it's wrong, they'll tell you. You know, don't be afraid to fight for what you believe in. You know, if you believe this is right, and I'm a new mother. Say if I was a new mother, because children have it as well. You know, you can get babies, and children have it.
Yeah.
You've got this baby. Oh, it's got Moyamoya disease. What's
As
Moyamoya?
you lost baby.
Of course. So to me, it's even worse because you're a new mum. You don't know about a baby, and it's got this disease. Whoa, it's like a bomb going off in your head. It would be like a bomb going. Just reach out. Reach out. I mean, I've read some people going through bad times that their partners have split because they've got Moyamoya. They can't handle the seizures. They can't handle the tremors. They can't handle everything else. You know, and people have reached out, and people have talked about it. Not just people with learning difficulties, typical developing people, people with babies, people with young children, single mothers. You know, and fan groups. Just talk if you can. It is scary. It's like going through a dark hole and not seeing the light, and nobody knows about it except you. I've been very lucky. I've got a mouth. I've got some good friends that's helped me raise awareness amongst the soul scene, amongst everything else. And as I said, I've got a team now, and hopefully it's going to get bigger, and people aren't going to be afraid because, it's not curable, but you get longer life. You get longer with that person, and that's all you want. I mean, she's 32 now. If I get another 30 years, another 40 years, well, I won't, but, she can live another 30, 40 years. That's brilliant. That's, and look at the research. Ask questions. Just don't take the first answer. Ask why, how, where, and if you don't think it's right, go somewhere else. Ask again. But don't give up. That's all I'm saying. Just don't give up.